thank you for Darn Talk. It's time to cross another item off my list. Well, after my appointment, I've got an initial consultation with a breast surgeon because I'm thinking about getting a reduction. We've come to Double Bay, which is on like the other side of Sydney, over the bridge. I don't come out this way to the eastern suburbs that often. I'm in like new territory. I've driven out here. I don't know where I am. I don't know where to park. Anyway, I've arrived. The appointment's in 10 minutes. I've just got to find the place and I'll report to you afterwards how it goes. I've got a list of questions. Here are my questions, and afterwards, let's see if I remember. I didn't bring a pen and paper. I trust my memory to remember the answers. Here are the questions I want to ask. How long does it take to recover? Can you do it? Are you in hospital or do you get to do it at home, which means I could work from home? Are you sort of stuck in bed or can you get up? Going back to work, how long does it take after the procedure? Can I go back to work? Can you work from home? Presumably yes, but I don't know whether you're going to have all your faculties about you after the surgery. Timing of the procedure, when can I book it? If I was keen to do it, how long does it take? Drugs, size options, because you know I want to go as small as possible. The scarring, is there like a breast lift as part of it? Do they grow back? Complications, and of course the out-of-pocket costs. Not that it matters, but it's good to know these things. All right, I'll report back afterwards. I'm back home now. I got answers to all my questions, and interestingly, if I wanted to get it done, I can get it done in like 4 weeks, which is a lot sooner than I thought. I thought there'd be a giant waiting list. So I'm still thinking, like I want to get it done, but I have to think about some options that she explained to me, because the smaller I want to go, let's say I want to go to a C or D cup, then because of the current size, there's some risk, and it's important that I'm aware of all the risks. So she went through, and because I'm a lawyer, she probably went through it more detailed than she would anyone else. But size is a consideration, and the procedure itself is a consideration that I need to kind of work through, because and it's kind of complicated, I don't know if I need to go into it, but there's various options that I have, and there are some risk and complications depending upon what choice I have. So I've got to think through that. I'm also going to meet with 2 other surgeons to have consultations with them for their opinion. I'm not going to tell them that I've already had this consultation. I just want to kind of learn as much as I can before I commit to the procedure, because there's risk, right? So I'll go through the questions briefly and then I'll tell you the answers. Recovery in hospital. So you only have 1 day in hospital. You're back the next day at home, and she says you can walk around. You can basically, and you're not bedridden. You can do light duties. You can't lift more than 5 kilos for the first 2 weeks. You can go back to work after 2 weeks. 1 week, definitely not. 2 weeks, borderline. You might be able to work from home the second week. No waiting list. You can have it done within 4 weeks. Drugs for recovery, endone, some other drug I've never heard of, Panadol, Nurofen. Size options. So there's a couple of options. The size options depends on what procedure I want done. If I just want a standard breast reduction, the lowest I could go is an E. And even then, there's a 15% risk with losing sensation in the nipple. If I wanted to go a CD, then I could do that, where she basically removes the nipple and then sort of reconstructs the breast and then puts the nipple back, but then you lose 100% of sensation in the nipple. And that is, so if I wanted to go smaller, that's the kicker. So I have to kind of think about that. It's called a nipple graft, I think she was saying. So I need to read up on it and get some further information about that. But I'm only 47, so I don't know if I want to do that. And to me, an E cup is small. Scarring, yes, she explained to me the scarring. I can draw a picture. So the scarring's basically these dotted, if that's the boob, that's the nipple down, like an anchor, and then around where she's going to be making the incision. That's basically what the scar will look like. Breast lift, yes, that's part of the procedure, and there's a little bit of liposuction if you want on the side bit. Do they grow back? Yes. Just through the normal passing of time, they can grow back. Complications, she went through a whole big list of all the things that could go wrong, including all the risk factors. Cost about $15,000 plus hospital costs, plus the anaesthetist and extra things after, I think it's medication. So I've got to think through that. The losing sensation of the nipple, 100% losing it, but then you can go down to a CD and it's easier for her to do the surgery, because she then, something about blood tissue, and if you lose the blood tissue, something about that, about flow, blood flow, very important, from the cells to the nipple. And there's risk of that anyway, even if I don't consent to the removal of the nipple and we keep the nipple attached and she just works with what she has, there's a risk you might lose sensation anyway and you might have to be back for another procedure. All very complicated. As I said, she's going to send me some material to read. I'm going to get my second and third opinion, and which my appointments are scheduled for that in February. So there probably won't be another update until then. Let's cross this item off the list. Number 9, the surgeon consult is done.